It's a life-changing event that can bring anxiety, but also joy. The prospect of becoming a parent. But for Black mothers-to-be, that joy can quickly turn to worry because of dangerous pregnancy-related complications.
Is there a way to reverse that trend? TV5's Jamie Sherrod looks for answers in this special report.
When Whitney Miles heard her baby's heartbeat for the first time, she was ecstatic.
I was so happy. I knew almost immediately that she was a girl, like from the moment that I could feel her inside of me.
Motherhood, an exciting journey that many women look forward to. But for Miles, that excitement soon turned to worry when she was 22 weeks into her pregnancy. That's when she was supposed to learn her baby's gender.
Their ultrasound technician was on vacation, so they transferred all of their patients.
A transfer that she says was life-saving.
The doctor explained that there were some things that were coming up on the sonogram that were abnormal.
Things that Miles says her previous doctor didn't notice, even though she expressed concerns with excessive vomiting, fatigue, and feeling like something was wrong.
But every time I would go into the doctor, which at this point was once or twice a week, they would say, you know, everything looks fine, she's fine, and they would send me on my way.
She didn't feel heard or helped. Thankfully, her new doctors discovered the cause of her symptoms.
She had intermittent and diastolic flow, if I'm not mistaken. And then there's something called absent and diastolic flow,
indicating fetal vascular stress and increasing the risk of fetal mortality. As for Miles, her blood pressure was dangerously high.
And it was just like a bomb drop.
A bomb drop that left her and her baby in the hospital. She gave birth at just 26 weeks because their lives were in danger.
I feel incredibly grateful. I look back through pictures and videos during that time, and I remember feeling like I wasn't going to make it.
Here in Michigan, the maternal mortality rate of Black mothers is around 5 times higher than white mothers. And when it comes to infants, Black babies die at a rate of 2 to 3 times higher than white babies.
One of the things that, we've seen is, women going in for care because they think that there's a problem or they feel like there's a problem. And sometimes, again, with this layer of racism and not being listened to, being dismissed.
Leslie Welch is a public health professional and birth advocate. She's also the founder of Birth Detroit, an organization focused on safe, quality care in pregnancy and birth.
Our disparities in maternal mortality and infant mortality are symptoms of a society that does not value all women and children equally.
Pointing to socioeconomic factors and race.
What can we do to reduce these disparities?
Examine how and where racism shows up in health system policies and procedures.
Welch also advises expecting mothers to trust their bodies, voice their concerns, and not to hesitate when it comes to seeking a different healthcare provider. They can also opt out of hospital births altogether and choose a midwife who is trained to help women during childbirth at a birthing center or their home. There's also the option of getting a doula to help during and after pregnancy.
Doulas are helpful in education, in emotional support, and in advocating for families throughout care, throughout labor and delivery, and postpartum.
Which she believes makes a tremendous difference.
Hi!
As for Miles and baby Jackson, they had quite the journey, but ultimately beat the odds.
Jackson, she went from being born months early, having to have a few surgeries. How would you describe her now?
A bouncing ball of joy. She exudes every bit of light and happiness and positivity. I look at her every day, and I'm genuinely grateful.
I'm Jamie Sherrod, WNEM TV5.